Hi everyone. Today we're going to talk in brief about low back pain and how we treat it here at Infinite Potential. Now, in general, everybody is going to be different and all treatments are going to be individualized, which is very important to understand around low back pain specifically because everybody is different. Everybody's pain is different for any area of the body, but low back pain tends to be something that really is person dependent. But just some of the key factors that you want to understand in regards to lower back pain are as follows. So the first one is to understand what it is and what it isn't as much of. So I can explain that a little bit further about saying that low back pain is multifactorial. So there's always a lot that goes into experiencing lower back pain, and it's not always related to what's going on the structures on the inside. And we don't have to get into as much detail about that, but even if you've had something like, let's say, a herniated disc or have been diagnosed with that in the past, those things heal, and sometimes those diagnoses aren't necessarily what's giving you symptoms right now. So even if you've had a history of a disc herniation or been diagnosed with one through an MRI, that doesn't always mean that that's where your symptoms are coming from, and in fact, a lot of times that's not where your symptoms are coming from. And that has been shown in the research by seeing a lot of people who have herniations and didn't even know it, and have never experienced back pain in their life. That being said, you can have pain that is related to a disc herniation. However, those also do heal. So even if you had an experience when you had a disc herniation and you know or are confident that that's where it came from, that's okay, because those do heal, and you can recover from that. So that's very important. I can go back to the thought of that lower back pain is multifactorial, because things like stress and sleep and nutrition and hydration, those play a role in how severe your symptoms can be, or those play a role in setting you up for the potential for having some sort of injury or having a flare. So next time you're having symptoms, I want you to look back at the days prior to the flare-up, and maybe you had a little bit less sleep, maybe there was a little more stress in your life, whether it was good or bad, but sometimes those, especially personally for me, those times do flare up my symptoms, and I have right-sided lower back pain. That's something that I manage, but I am able to do everything that I want to do, just sometimes it comes up. The other very important thing that we'll wrap up with is that 80% of low back pain cases get better. So it's a matter of how you get to that point of getting better, but that's a huge probability that if you do have it, you're going to get better. Now, that's sometimes difficult to understand because you may be someone who has dealt with low back pain for 25 plus years, and your treatment is going to be slightly different from someone who just had a recent flare-up that they have no idea where it came from and they've never had it before. However, in 80% of cases, and that's proven by the research, that low back pain does get better, and that the other factor is that there are a lot of people, actually the statistic is 540 billion people every day deal with lower back pain. And that is a staggering statistic to know that a lot of people have it. So it is a condition that is very prevalent, but is seen a lot in the world of physical therapy, and we feel confident in treating it and making you feel more confident about it. So if you have any questions, definitely let us know, but there are plenty of treatments and activities that we do here that do positively affect symptoms in the lower back. So we'd be happy to share them with you, and if you have questions, please let us know. Thank you.